Perform hand hygiene. Position patient properly, elbow on 90 degrees and hand rest on the table. Note that the normal range of pulse rate is 70 beats per minute. Using the index and the middle fingertips, locates the radial pulse thumb, side wrist and press it lightly to feel the pulse. Note if the pulse is regular rhythm or weak or strong. Using watch with second hand, counts the number of pulsation in 1 full minute. Then document the results. Whilst your fingers are still in place with patient's hand on the chest for the pulse check, pretend that you are still checking the pulse but observe the patient's respiration. Note the rise and fall of the patient's chest, note for the depth and rhythm. Count for 1 full minute, remove the hands from the patient's chest, and document the result. Normal range for respiratory rate is 12 to 18 breaths per minute. Using the stethoscope, warms the diaphragm, checks on the heart rate by placing it over 2 to 3 inches to the left of the breastbone, below the left nipple, or at the left upper chest. Counts the heart rate for 1 full minute, notes for the rhythm if it is regular or irregular. Normal range for heart rate is 60 to 100 beats per minute. Then document the result. Wear non-sterile gloves to check the blood sugar. Check the expiry date of the strips, verbalizes how many days the expiration of the strips upon opening and the labels. Select the finger to be pricked, clean with alcohol swab and dry. On the glucometer, confirm if strip matches the glucometer code. Insert the strip into the glucometer as indicated in the screen. Pull the plunger of the lancet holder and press it against the cleansed and dried finger side. Squeeze lightly the prick finger and touch the drop of the blood with the strips as indicated. Apply light pressure on the punctured finger with dry gauze or cotton. Wait for the result to show on the screen and note the result. Turn off the glucometer, remove the strip, and put it on the container together with the lancet. Remove the lancet, press the release button to eject the used lancet in sharp container. Doff on the used gloves and perform hand hygiene. Document the result. Report all results to RN for immediate management. First, warms the selected site to check the SpO2, earlobe, toe, or finger. Start the oximeter by pressing the on button. Insert or clip the finger on the device. Wait until the result appears, and then document the result. Using auxiliary thermometer, expose the patient's axilla, dry with towel. On the button of the thermometer, place probe in the center of the axilla. Wait for the beep tone. And document the result. Perform hand hygiene. Verbalizes the precautions to be considered before taking blood pressure. Do not take BP on site of IV infusions, cast, dialysis access site, breast surgery, and injured site. Position the patient properly, arm level of the heart, palm up. Expose the upper arm where the cuff is to be applied. Squeeze the BP cuff to expel the remaining air. Close the valve on the bulb. Finds the bronchial artery using index and middle finger tips. Place the arrow on the cuff over the bronchial artery. Wrap the cuff around upper arm at least 1 inch above the elbow, even and snugly. Attaches the BP up gauge in the cuff for aneroid type. Place the stethoscope around neck, locates the radial pulse. Method 1. Inflates the cuff with the right hand until the pulse is not felt, and note the reading from the gauge. Place the stethoscope earpiece into both ears and the diaphragm into the bronchial artery using the left hand, pressing the diaphragm with the index and middle finger. Inflate the cuff 30 mm of mercury beyond the point where pulse was last felt. Deflate the cuff slowly 2 to 4 mm per second by turning the valve screw counterclockwise. Note the point when first sound is heard. This is called the systolic pressure. Continue deflating. Note the point where the sound disappears. This is the diastolic pressure. Note that the normal range of blood pressure is 120/80 mm of mercury.